going to make this one short. This is about cultural implications. We talk about this pretty much in every class that we go through. So we're going to go and talk about different cultural implications when it comes to mental illness. I think you guys know these definitions. We know what a minority is, right? Race, we know. Ethnicity, I think you guys know the difference between all of this, so I'm going to go through it kind of quickly. With the U.S. Census, they actually look at race and ethnicity together, they do it to help the government understand the needs of the citizens. I'm sorry, my son is yelling at me. So hopefully this helps to identify needs that we're seeing based on different racial groups in our country. By 2043, that they actually believe not one group will make up the majority, or 51% of the populations. However, non-Hispanic whites will continue to remain the largest single group. So that's interesting. We're seeing our country become more and more diverse over time, which impacts nursing care, and something we want to make sure we're really aware of so that we can meet the needs of all of our patients, not just one specific group. We know that when it comes to culture, people look at mental illness in many different ways. And, we talked about this in class a little bit, how depending on where people were from, how their parents might feel about mental illness. And so I really think when we look at mental illness, we not only look at someone culturally, what their cultural beliefs may be, but also their age, because depending on what generation there's a big generational difference, I have found, to how mental illness is thought of. So basically, Western tradition, people look at, here we believe in autonomy and independence, often that the mind and body are separate. So that's sort of what you see in Western. In Eastern, family is usually the basis for identity, and that mind, body, and spirit are really one entity. Time is sort of this circular idea. So they kind of have that, they believe in the opposing forces. So the hot, cold, you'll see often in Eastern tradition, depending on what's wrong with you, you may take hot fluids versus cold fluids. I always find that really interesting. Indigenous cultures look at the natural world. So these would be like our Native American patients. They often are going to look to their tribe, possibly, and really look at how the environment affects their health. So it's important that we remember that someone's culture may impact their beliefs on mental health. But I also want to give the caveat that it may not. I mean, someone who is an 80-year-old Native American may have a whole different opinion than someone who's a 15-year-old Native American, and who may have more kind of modern beliefs, I guess. I don't know if that's the correct word, but enculturation, you share norms with new members of a group. So that's the idea of kind of ancestors passing down the norms to the younger generations. And sometimes the younger generations don't have exactly the same type. They will deviate a little bit. So deviance from cultural expectations can be defined as illness by other members of the group sometimes. Sometimes other members of the group aren't okay with that. Ethnocentrism is the idea that what you think is right. And so it's really important that we are aware of nurses, of what our beliefs are, and really try to step aside. And whether you believe drinking cold or hot fluid is going to affect someone's health, if they believe that, then you need to respect those beliefs. And you don't want to do cultural imposition, which would mean you're trying to impose your beliefs on someone else. And so sometimes we do that without even realizing it. I can do that, I think, sometimes by, really paying attention to someone's attitude about touch and things like that. I like to hug everyone, and sometimes I need to understand that's not in everyone's cultural norms. So lots and lots of things can provide barriers for different cultures to mental health, whether this typical beliefs have stigma, whether there are, they come up with their own reasons for why it's happening. They kind of have their cultural idioms of distress in what's happening, and they try to explain it. We also have to remember that depending on genetic variations, we have to see their body may metabolize drugs and alcohol differently, or medications differently. They may not even have the words within their culture for some of the mental illness symptoms. And I think we talked about that in class a little bit, that in some cultures, there just aren't even words for depression and anxiety. And so then they can end up being misdiagnosed, let alone communication barriers. If you have a language communication barrier with someone, it can be really difficult to just, even with an interpreter, to get the basic information you need, let alone to really try to get them comfortable and able to open up and answer the right questions you need to assess their mental health. So just kind of different things for you to think about. We know that immigrants, refugees, and cultural minorities are really the most at risk because often it's an access to care issue. So it's just something to really think about our at-risk populations. And I mean, refugees in and of themselves can have multiple stressors on top of that. So the takeaway really from this whole chapter is, as a mental health nurse, you need to have cultural awareness, cultural knowledge. You need to have an understanding of various cultural encounters. You need to develop your cultural skill, and you need to have a desire to understand that different cultures look at mental health and mental illness differently, and to really respect that and really have a wonder and want to understand that. And that's what's really going to make you a good psychiatric mental health nurse, is to celebrate how our world is so diverse and how we look at things so differently, and we can really learn from each other and not impose what we believe. So I'm not going to read everything to you. We'll go through this quickly. Cultural awareness is that really you have your beliefs and values, and that basically the culture of the patient, the nurse, as well as the setting are all, all of that is playing into the component of it all. And so just something to think about when you're with a patient. You want to develop some cultural knowledge. Ask people from different cultures. What do you guys believe? Like, tell me about it. Help me understand. What does your, how does your country treat moms who've just had babies? Is it okay for men to cry in your culture? What's that looked at? Just all those kinds. Ask around. Have an attitude of wonder. Always have a scholarly attitude and an attitude of wonder for people around you, because that's what makes nursing so amazing when you do that. Cultural encounters, you want to really help yourself not to stereotype. So maybe just because someone comes from an Eastern culture, you don't necessarily want to make the assumption that they have hot and cold, but you may want to ask, tell me how you would like your water. Would you prefer ice in your water or not? You can ask, but you don't want to make the assumption, because as we know, not everyone follows the norms of the culture that they were raised. Cultural skill is that you are able to perform a culture assessment in a sensitive way. So how do we do that? We use standardized tools that do that in a way that's sensitive. We try to use a medical interpreter because we know a medical interpreter is really what's best for a patient, not the family members, because we can't guarantee the family member is necessarily interpreting correctly. And if we are going to give the best care possible in an ideal situation, we use a medical interpreter. And we really want to come up with a plan that is acceptable to the patient, but we also know is going to help them. And sometimes that can get complicated, and sometimes it becomes an ethical and legal issue when you think about maybe someone who's Jehovah's Witness and doesn't want blood transfusions and they have a child. I mean, that's an extreme, circumstance, but, often if you can come up with a mutually agreeable plan, you have a better chance that they're going to follow through. If you believe the only way to treat this patient is medications, and you have a patient who refuses to take medications, you've reached a stopgap that you need to try to get past. So it's really important to not just impose what you think, but to really include the patient in that conversation. And you want to have a desire. You always want to have a desire to listen to their viewpoint, to understand, to be patient and empathetic, and really have that genuine concern. And this is where I talk about that wonder. You want to maintain a wonder of the unbelievable differences that are so exciting around you when you meet other patients, as well as always have an attitude, a scholarly attitude. Always learn more. Never assume you know everything. And that's it. How was that for short and sweet? Thanks, guys. Of course, I can never turn this off correctly, but bear with me.